What is the impact of graft versus host disease on the overall prognosis and quality of life for acute myeloid leukemia patients?
This is another area where, GVHD, I want to say, gets a bad rap, because when we talk about it and we have to talk about all the negative things that can come with it, most people will come into transplant thinking that, they just don't want to hear that word, and if that happens, all is lost. But in truth, graft versus host disease, a little bit, is not necessarily a bad thing. And the reason I tell my patients this is we cannot see graft versus leukemia. Remember, that is the immune cells going after those stubborn, resistant leukemia cells, the whole reason for the transplant. We can see graft versus host disease, and they do go somewhat hand in hand. It's not perfect, but we know that people who have any type of chronic graft versus host disease are actually less likely to relapse from their disease. So it's complicated. I tell patients, my perfect transplant is one where you come out on the other side, you never have a single bit of GVHD, and your leukemia never returns. 5 years later, best thing ever. But if you do develop graft versus host disease, which is very common, more than half of patients will get some type of graft versus host disease, that a little bit of graft versus host disease might be our positive signal that those cells are in there, they're active, and they're doing the job that we ask them to do. There is certainly another side of that coin, graft versus host disease that is very severe, can be a debilitating and sometimes life-limiting illness. Acute graft versus host disease that responds to treatment is something that we work through, but very severe chronic graft versus host disease can be trading the disease of AML for a different disease. It may significantly impact on the quality and quantity of life.